am recording and letting folks in. And
don't forget to share the other screen.
Hello, everyone. I'm so glad to welcome you to tonight's event on the mutual aid and the fourth wave. Welcome, Helen, Zach, John, you're welcome. Please kindly introduce yourself in the chat box with your name and your contact information. Thank you. Thank you, Larry. Thank you, Shulan. You're welcome. Thank you, Chanta. Please kindly introduce yourself in the chat box with your name and your contact details. Thank you. This is Neighborhood Pulse citywide mutual aid community call, and we'll be having a chance to hear from experts tonight on important topics related to the COVID-19 vaccine and the fourth wave. So once again, welcome everyone. Please don't forget to introduce yourself in the chat box. But before we proceed, I would like to invite Shanara to read the land acknowledgement. Over to you, Shanara.
Thank you, Fumi, and welcome everyone. Thanks for joining us. So I would like to acknowledge that Toronto is built upon the traditional lands of Mississauga, the Anishinaabe, the Haudenosaunee, the Chippewa, the Huron, and many other indigenous peoples. I would like to acknowledge that Canada is founded on white supremacy as a trade and commerce economy that continues to affect the lives and well-being of indigenous peoples, putting economic greed in front of indigenous rights. This event has been organized by Neighborhood Ports TO, a mutual aid project that is based in the indigenous cultural worldview of kingship, taking care of your community and sharing what we have with those around us. Although we are doing this work on Toronto soil, it is important to acknowledge that there is a long way to go before conciliation can occur between the City of Toronto and Indigenous peoples. Finally, I would like to acknowledge that many Indigenous peoples from across Turtle Island live in Toronto. I would like to value their diversity of cultural worldviews, their resiliency, and their ties to their communities. We also recognize that many folks in Toronto are newcomers and communities who were brought here against their will through the transatlantic slave trade and other forms of imperialism. Thank you. And I would like to pass it on now, Fumi. Thank you, Fumi.
Thank you so much, Shanara. Next now, I'll be going through the agenda for today before I pass it on to our moderator. First, we are going to start with a quick Zoom overview, just to be sure everyone knows how to manage this space. And in terms of Zoom overview, here is a quick overview of the bar across the bottom of Zoom. We are in a group call, so make sure you are muted. Please kindly mute yourself. Video is encouraged, but it's not mandatory. So because it is nice to see each other, we'll be recording this session. So if you want to remain on scene, please turn off your camera. You can as well make use of the chat box, button to open the chat box. If you haven't done so already, please say hi in the chat box and introduce yourself. We'll also be using the chat function for the question and answer. So if you have questions at any time, please add them in the chat button. Today's community call, our purpose for tonight is to support informed community conversations on key vaccines and topics. And our outcomes are building collective knowledge on key themes that are related to COVID-19 and the vaccine. We will also be focusing on communities that have been made vulnerable, and we'll also open up ongoing conversations that will happen across the city. So on our community agreement, this space is dedicated to creating an equitable, diverse, and inclusive environment for all members of the neighborhood. Our meetings will intentionally build accessible and welcoming spaces for people of all races, genders, classes, abilities, ages, cultures, religions, and sexualities. We will not tolerate harassment of any form, including but not limited to racism, classism, sexism, ableism, homophobia, transphobia, or any other oppressive language and behavior. If you witness or experience harassment, please inform a member of the organizing team. We are marked by a star and the participant. We will also be offering a breakout peer support space with an active listener. Now, I'm going to be introducing our moderator for tonight. He is an amazing community organizer in so many places. He's a Walid Kogali. His name is Walid Kogali. He has worked to champion issues such as affordable transit, environmental stewardship, equity, and human rights in both the communities and across the city. He is well known for his work with residents from all backgrounds to create safe, inclusive, sustainable communities that are free from discrimination and hate. He is so passionate about building a society in which all people can reach their full potential. He is the co-founder of the Coalition Against White Supremacy and Islamophobia, a coalition of over 170 organizations that mobilized the February 2017 National Day of Action in response to the Trump administration's Muslim ban and the deadly Islamophobic and racist attack on a mosque in Quebec City in January 2017. Please join me tonight to welcome Walid Kogali Ali as our moderator. Over to you, Walid.
Thank you so much, Sister Fumi. What an introduction. Really blown away. Thank you so much. And I want to welcome all of you folks for joining us tonight. I see we have about 33 participants, and more folks will be joining us in the next 2 hours. And I want to thank you for taking some time to engage public health experts and other subject matter experts on the impact of the fourth wave, with a specific emphasis on mutual aid and vaccination supports and questions. So we're going to get started soon with an introduction of our panelists. And then we're going to move forward with our agenda with a question and answer section where you will be able to ask your questions as well. So I want to ask you to help me welcome our panelists. So our first panelist of the evening is Dr. Candice Todd. Dr. Candice Todd is a naturopathic doctor with expertise in health promotion and disease prevention. Dr. Todd completed her honors Bachelor of Health Sciences degree at the University of Western Ontario. From there, she followed her passion for health by completing an intense 4-year program at the Canadian College of Naturopathic Medicine to earn her Doctor of Naturopathic Naturopathic Medicine diploma. So that's Candice Todd. We also have our next doctor is Dr. Trevor Aldridge. Dr. Trevor Aldridge is the Senior Director of Quality and Compliance at Brevitas Consulting Incorporated. He has more than 30 years of industry experience, including product and process development and the manufacturing of biopharmaceuticals. His previous positions include Director of Quality Operations with Sanofi Pasteur Limited and Drug and Biological Specialist with Health Canada. So welcome, Trevor Aldridge, to our panel. Our next panelist and our final panelist is Fernanda Yan Chapaxi. Fernanda Yan Chapaxi is an active member of the Ontario Parents Education Network, OPAN, a collective of parents from across the province organized to fight against cuts in public education, to protect public schools, and to demand for a more equitable and accountable public education system. Welcome, Fernanda, for bringing that very important perspective to this important community conversation. So those are our panelists for today. So what we're going to do next is I'm going to encourage folks who've joined this very important conversation to start thinking about questions they might have with regards to the discussion we have today, and start typing away in the Q&A. We do have some questions that we're going to ask our panelists, and then we're going to dig in deeper into some of the questions that you folks will be sharing with us. Okay. So what I want to do is I want to make sure that everyone has that opportunity. So let's see if on the chat, we're getting more folks here. So please introduce yourselves. And then we're going to be starting our Q&A in about a minute or two.
My name is Farsad. Hi. Hi.
Welcome.
My name is Farsad Debbie.
Excellent. Okay, so we're going to get started with our panel questions. And I'm going to ask any of our panelists to answer this question. Specifically, our first question is, health experts have warned us that we are in the midst of a fourth wave. Could you tell us about what is driving the fourth wave? Who would like to answer that question? Can I ask, Trevor, you're muted?
Oh.
No worries, my friend.
Yeah, sorry.
Candice?
It's Trevor Aldridge. It's great to be here with you this evening. We're quite happy to pass on any information that we have that might be helpful to anyone who needs to make a decision regarding vaccination. So in terms of what's driving the fourth wave, there's a very easy answer, an obvious answer, and that is that the Delta variant is what's driving the fourth wave. Now, the Delta variant is one of the variants that emerged in India some time ago. And one of the reasons why the Delta variant is driving the fourth wave is because it's, with viruses, what viruses do is they mutate. And when viruses mutate, things can happen. So the Delta variant is shaping up to be much more effective. And also, not only does it infect more efficiently, but it also seems to offer more serious health issues when you get infected. So that's what's driving the health wave, the fourth wave. And so the data is pretty clear too. Most of the people who are being infected more recently do have the Delta virus, and that's primarily what we're seeing. And it's just again just a normal, not a surprise. Once you start having things like a viral outbreak, the normal course is if it's not contained very quickly, you can expect to have variants showing up. So that's really what's driving the fourth wave.
Excellent. Thank you, Trevor, for that eloquent response. Candice, do you want to add anything to that?
Yeah, I just, echo Trevor's sentiments, and we're also sort of anticipating, coming into the fall, kids going back to school. So there's just more opportunity for spread as well.
Thank you for clarifying that. The next question that I have is for Fernanda. Fernanda, you've been a strong advocate for safe schools and equitable education for families throughout the pandemic. Could you tell us what parents should know as we head into the new school year?
Hi, thank you for having me. And Hi, everyone. So I don't have good news, probably, and it's certainly not what parents and caregivers would like to hear just 2 weeks before school starts. But I want to share it in order to hear me, in order to be able to connect with other parents and hopefully organize and change the fate of this fall. So the last 2 school years have been hard. It has affected educators and students immensely, especially students and families from racialized communities and communities that have been harder hit by COVID. And I'm sure everyone here has felt this in your own home or in someone that you know who has children and who have kids in the public education system. But before this started, we already knew that most dangerous combination for COVID was crowded places, close contacts, and enclosed and unventilated spaces. However, none of these was addressed by the government before school start last year, and it has not been addressed this year. So we are heading into a school year that will likely drive a significant number of COVID infections in school-age kids. Likely will also end up, potentially can end up in like more remote learning in Ontario that has already affected us all in like the most brutal ways. And we'll have again parents and educators struggling again, because we have not have improvements in ventilation systems in school buildings. There is not additional funding for small class sizes. The school reopening plan is not safe. And in fact, it contradicts many of the measures that that had been advised by epidemiologists and that have recommended that we should do. Children under 12 will not have access to vaccines before the fall, before the school year begins. And this will put our kids' health in unnecessary risk unless all these vital measures are implemented. So what we cannot change COVID, we cannot change probably the course of COVID, but we can do, I think we can do is probably as parents, we can mobilize, we can organize, we can stand up against the government and really demand for like a science-based health and safety plan for in-person school that includes ventilation assessments, mandated cup sizes, rapid tests in schools, contact tracing. There has still no information about contact tracing. And I think it's hard to now, see the fall without worrying about these other things. But there might be maybe a small window or like a few windows between now and the winter when we could potentially change that if we demand for all these actions from the government.
Well said, Fernanda. Thank you so much for sharing those very important pieces that we should all be aware of, specifically when it pertains to the needs of not just our children, but also what parents have been advocating for. And actually, as a follow-up, I'm really curious to hear from the rest of the panel. Many people feel like there wasn't enough action taken to prevent the deadly waves we've experienced. Do you think the fourth wave was preventable? And how do you think this feeling impacts people's confidence in vaccines or other measures that have been deployed to help protect the public?
Well, I can start that discussion too. So we know that the Delta strain originated in India, but by the time we got to Canada, we knew it's pretty difficult to contain a strain within a country's borders these days. I mean, it's just there's just too much communication between various parts of the world. So once you've identified a strain, the likelihood it's going to show up on your doorstep sometime soon is not remote. So in the case of the Delta strain, we had seen it in other places before it got here. What you're doing is you're trying to anticipate what's going to happen when it gets here. So the fact that there was a strain that was more virulent, if you like, meant that it was something we should be preparing for. And in fact, just to address your point a little bit more, it's not unexpected to have waves, and in fact, we're likely to have more waves before this is over. So in any case, but in terms of the Delta strain, we know we could anticipate it being here, and we did recognize it, and then we can see it as we start, as we look at what's happening, look at the data coming out of the current infection rates. But in a sense, we were a little bit fortunate though, because by the time we started being concerned about the fourth wave, and certainly in our part of the country, we were fairly well along in terms of getting people vaccinated. So we're not in bad shape from the perspective of having some percentage of the population vaccinated, although maybe not as far along as we would have liked. Because even if as long as you are vaccinated, have your full dose, your 2 doses of any one of the currently approved vaccines, they will confer some immunity against the Delta variant. And in fact, all of the variants that we're fairly concerned with, we are somewhat protected by having 2 doses of whatever the vaccine of your choice is, Pfizer, Moderna, or J&J, or AstraZeneca. So in that sense, we were not badly off. And in fact, our situation is not desperate right now because of the rate that we are at in terms of vaccination is not bad. It's not where we really need to be to say we've addressed the problem, but it doesn't mean that, even though you may have a virulent strain, the risk is really from the people who are either unvaccinated or people who have maybe 1 shot, or we don't know what their actual vaccination status is. That's where the risk is. At this point, we can see the daily numbers of the new infections and the sort of we're seeing things in a range of now, we're seeing somewhere between the 400s, the 600s, and certainly in Ontario daily, and that's kind of what the experience is. And so the best case situation for us is to sort of manage that and keep the rates down. So we also see that more recently, vaccination rates have started to go back up a little bit. But the point is that it takes at least 2 weeks for you to develop enough antibodies to see any impact on vaccination rates. So based on that, if we can expect to see increased vaccination rates, we can also kind of work with the time frame where we may see some impact on reducing the number of new infections. So that's really what it really means. But one of the things that we need to consider too, we know that we're looking for some specific number, some range, in order to say that we are at a point where we can achieve something like herd immunity. But what we also don't know for sure is whether does that number.
It's okay.
Does that number also require us to have some children vaccinated as well? So those are some of the questions that are impacting us right now. And in terms of the fourth wave, I can't say that, if we had started earlier, if we had more people vaccinated earlier, I would say that we probably would not have had, a significant fourth wave, and that's what we were all hoping for. But that's pretty much the situation we're in right now. We just need to manage out of it.
Excellent. Dr. Candice Todd, do you have anything to add? And Fernanda, I'd love to get your perspective as well.
Yeah, I agree. I agree with respect to the fourth wave. Preventable, probably not, but could all of this been better managed? I definitely agree, or believe that it could be better managed. So, a lot of the things that Fernanda mentioned with respect to implementation, and Trevor mentioned with respect to, more efforts to get people vaccinated earlier. A lot of the communication was confusing, I believe, as well. So that sort of brought out a lot of hesitancy with respect to just getting vaccinated in general. So definitely could have been better managed, in my opinion.
Excellent point. Of course, is a lot of room for improvement. Fernanda, do you want to go next?
Yeah, so I'm not an epidemiologist, so I certainly don't know everything about, like the waves and the variants and how will they look like in the future. But I think that there is like a fourth wave that is driven by, yes, a Delta variant, but it's carried mostly by people who are unvaccinated. We have a strong anti-vaccine movement that spreads misinformation. I mean, I often get in emails from my neighborhood mailing list with all sorts of links to articles that like full with conspiracy theories. And I think there is also insufficient information about the vaccine in many communities that has like make people hesitant to give consent in order to be vaccinated. But I think this wave and the other wave may not have been preventable in terms of like the variant that is developing in other places, but in how it has the impact that it has on the communities. And I think that is preventable in this wave, and that has been preventable in every single wave except for the first one, because we didn't have enough information about COVID. We didn't know what it was. We didn't know what it was happening. People had very little information about what it was and how it prevented. And I think that main responsibility relies on the government, who could have not just managed better the policies and everything, but also like make decisions that will actually help us less number of people. It's not just the amount of cases. People have literally died in the most unbearable conditions because the government failed to implement conditions that keep them safe inside their long-term care homes, inside their schools, inside their hospitals, inside the communities, inside the work placements. So those deaths were preventable.
Can I just add one thing to that? And
Go
certainly,
ahead.
In terms of the long-term care homes, that's one of my pet peeves, because I think that we should never have experienced a second wave in long-term care homes like what we did, and even beyond that. So to me, I would say that was negligence.
Qadiri.
Absolutely.
No.
Thank you, Trevor, for articulating that. You're right. It's a tragedy. And the fact that we have multiple waves impacting the most vulnerable members of our communities is tragic. And let's just remember that variances have come from different parts of the world, whether it was India, as you referenced, Trevor, or Brazil, or the UK, the United Kingdom, or China, and now there's also a variant that's been reported, the Lambda variant, that was detected in Peru in August of 2020. So there are variances that are spreading around the world, which indicate the importance of global cooperation in addressing the impact of this pandemic. It can't just be a one country approach. And that's why we have organizations like the World Health Organization supporting the global efforts. And if we continue to ignore vaccine equity, we do it at our peril, as we've learned through the data. So I want to move on to the next question for our panelists that I think will help before we get into more of like the questions asked by community members. And that is, we've also been hearing a lot about the Delta variant in the news. Some folks may have already heard about the Lambda, which I just talked about, a variant that's also in California. Could you tell us more about the variants and how they affect our ability to gain immunity from COVID-19? So for folks who just don't understand the science, they just want to understand, how does this work and why do these variances keep coming? So that will be a great way to clarify that. Specifically, tell us more about the variants and how they affect our ability to gain immunity from COVID-19. Who'd like to go first?
I can start it again. And so, first of all, it's important for everyone to remember that this is a pandemic. So, we're talking about a phenomenon that's happening across the world. And we're not going to solve this problem unless we solve it everywhere. That's the first thing. And the reason why I want to make that point is because if we're looking at, say, vaccination rates in North America, Europe, countries that are fairly advanced and have infrastructure and have the resources to make vaccines and get themselves vaccinated, that's solving very local problems. But it doesn't make you immune from what's happening in other parts of the world, which is exactly what we have to be worried about. So, for example, if we say that we're we can get our vaccination rates up to say 80-90%, and that would probably get us close to a point where we're feeling fairly comfortable. It does not mean that you're immune to strains that will arrive from other places. For example, even with our vaccination rates that high, the vaccination rates in most of the rest of the world, really, very populous countries that have real issues around dealing with this, the rates are somewhere in around less than 2%. That's the reality that we're dealing with. A vaccination rate that low. So everyone is talking about vaccine equity, but there are some huge problems. And if we're talking about getting everybody around the world vaccinated, that is a huge undertaking. I was just looking at some reports from the World Trade Organization, just looking at the resources to get enough vaccines to vaccinate all the people who need to be vaccinated is a huge task. And that could take a fairly long time. I'm not sure what anybody was thinking, but that's probably a project that's going to take place over years. So the only thing that we can hope for is that we can get a lot more people vaccinated more quickly, and so that we can reduce the probability of producing variants in places where there's a great opportunity to produce variants. The problem with being able to produce variants is that you have no control, because what's going to happen is when mutations take place, there are two possibilities. They could be fairly benign, or they could be, become much more virulent. They could affect you. They could increase the infectivity. They can increase the health effects, and certainly those are all advantageous to the virus. So the whole point is the risk. What it does for our immunity is that if you're not able to get to a point where you can control the increase of dangerous variants, you're still going to be dealing with a problem that you may be able to control just by having a very, very high rate of vaccination, but you won't be able to prevent it. You're still going to you still have a problem out there. So in terms of immunity, what we really want to get to is a point where we're controlling the rate of infection everywhere. Either that, or you're going to have to isolate yourself. I mean, the two countries I can think of that have done a fairly good job of isolating is New Zealand and Australia. New Zealand complains when they have two people infected, and they're very upset. But they've managed to isolate themselves from a lot of this fairly well. But that's not going to happen for the rest of the world. I mean, so that's where I guess that whole vaccine equity issue comes up. But to me, just saying vaccine equity does not do anything, because you still have this huge logistics problems of trying to get. And I've made vaccines for a long time, and most of the vaccines that we traditionally work with are just require storage at 2 degrees C to 8 degrees C, but we have to transport them to the far corners of the world, and that is a huge challenge. Now we have vaccines that require storage at minus, whatever, very, very low temperatures, and that is huge. And these vaccines are fairly fragile, so it's a real challenge to get these things to all the places where they need to get to, and still have them usable. So those are some of the real challenges that are going to have to be dealt with. It's nothing that we can't solve, but it doesn't mean it's a huge undertaking.
Thank you for pointing out the logistical challenges with getting certain types of vaccines. I'm assuming you are speaking to the mRNA vaccines that require colder conditions for storage, and especially in parts of the world where that capacity doesn't exist, and also distribution, right? We've got the DNA type of vaccines like AstraZeneca and Johnson & Johnson that could be deployed to communities to support their public health efforts. So thank you, Trevor, for pointing to the need for action, not just rhetoric, and what those challenges look like. Dr. Candice Todd, do you want to go next with your opinions with regards to the variants and how they affect our ability to gain immunity from COVID-19?
Sure. So there are, and I'm definitely Trevor is the expert in this, but with respect to variants, as you mentioned earlier, viruses like to mutate. They want to mutate so that they can, that's their survival mechanism. They're trying to, last as long as they can. And what we're finding is that, with vaccinations, there are a few factors that can make us more prone to these variants. So some of the things that are still being, I guess, researched as we go along, because this is, at the end of the day, this is a very new thing for all of us, is the immunity, how long we're protected by our vaccines, like when we need to get booster shots, things like that. And I think that that is something that the variants are, they can sort of wiggle their way in there. So if you've had, you got both your doses in January, you may not be as protected now as if you had them in April, for example. So there's opportunity there. And yeah, they're just more virulent and can impact people who are, I guess, more at risk more often. So people who are, potentially immunocompromised, people who have those underlying conditions would be more likely subject to being infected by them. And I don't know if Trevor, you want to add more to that.
Well, no, I think you've done a pretty good job there. There's no question that that people who are the whole thing about these vaccines is that typically you would have a longer time, before you actually launch a new vaccine, get a little bit more experience. And not that there's anything wrong with what we're doing now, because I mean these are really great vaccines. But you get a chance to do what we call stability studies, so you can get a better profile and how long the product is good for. So, but we're learning some of this as we go along. But the thing is, we're gaining that data constantly. So, for example, a lot of studies are available that shows that you can have good antibody levels at 6 months to 9 months, based on some that I've looked at. But we also know because there are a lot of studies that have also been done in places like the UK and Israel, and they're also showing that, as Candice mentioned, that if you're immunocompromised, your antibody levels are, you may not be able to produce the antibody levels that you would normally produce. Another person might. You're already starting a little bit behind. So for those people, it is advisable for them to get the booster or the third dose, if I think they would prefer to call it in that case. So there are all those discussions ongoing right now. It's more a question of getting the data to support whatever is the right decision to make. And it's part of this whole process of we could not delay bringing the vaccines forward, because I mean in 2020 everybody was saying acknowledge the fact that the only thing that would get us out of this finally would be to have vaccines, and nobody actually expected to have a vaccine by November of 2020. So I can tell you that's a real inflection point for the industry being able to do that. But definitely people who are immunocompromised, or people who not everybody, with this. So for example, some of the vaccines that we're talking about have what's called 95% efficacy. So what that's telling you is that it's not 100%. So therefore, some people may not respond to the vaccine like others might do. So those people, may need a little bit more to get them up to a level that makes them even immune to some of these infections. So yeah, that's pretty much what I'm looking at.
Well said. And Candice, thank you so much for explaining how viruses like to cling on. And I think the data has revealed that it likes to cling on the unvaccinated, and those by choice and those that can't because of the age group, right? So you can't get a vaccine if you're 11 or 10, right? Or 9 or 8, you can't, because it's not available to those folks. But, we need to make sure that folks are aware that the fewer folks that are vaccinated, the more variants keep on multiplying and also challenge our efficacy when it comes to protecting folks, right? There are new variants that are challenging the efficacy of our vaccines that are a miracle, in my opinion, for being developed so fast, as Trevor articulated earlier. So what I want to do is ask the following question. And Fernanda, please feel free to weigh in, in this question. Specifically, COVID-19 is disproportionately affecting poor, disabled, BIPOC, and working class communities. BIPOC, Black, Indigenous, and people of color. That's what it means. We're hearing a lot of questions in the community about vaccines and whom it protects and whom does not need protection. So, for example, our youth. That was sort of the conversation at the beginning of this pandemic. We've seen how easy it's been for the public narrative to fixate on the idea of anti-vaxxers. But we also know that these communities have experienced ongoing violence in the healthcare system. Do you have any advice for folks who are supporting community members in getting the vaccine, especially our youth?
I do think that there are anti-vaxxers out there. Like, no. It's certainly, it's so interesting because if I don't know if people know, but like you can actually go to the City of Toronto website and you can search by school and you can see the vaccination or the immunization rate by school with the latest data in like from 2018 before COVID. And you will see that there is a 10% of students, about like between 0 and 10% of students in some schools, actually like alternative schools, they have up to like 40% of students who are not vaccinated from like polio and the measles and like the very basic vaccines, mandatory vaccines for children. So there is that. So that we will not be able probably, if we didn't reach those parents to vaccinate their kids against polio, I don't know if we will reach them to vaccinate them against COVID. It will be hard. So there will be a percentage of parents that will likely not get vaccinated and will not vaccinate their kids. I'm not sure if youth will reach, if we will not reach the maximum vaccination rate that we have for youth. I've seen and I follow the vaccination rate because I want to make sure that my kids are safe in school. And what I see is that the youngest communities, the youngest age groups are the ones who have the highest vaccination rate. So you go the same in the City of Toronto website and you see that between the 12 and 17, they are almost 80%. The 18 to 24, they are at 98%, which is the highest vaccination rate in the city. Wow. So I'm like, now, if there is any babysitters between, I'm all for like teachers and babysitters between the age of 18 and 24.
Amazing.
And then you see the 25 to 29, that is also very high and like have reached the 90%. And then you get to the older like ages between the 30 and the 54, who are mostly the like people like me, my age, people who have parents, who have the lowest vaccination rates in the city. And that's the community who we have to look out. Like many of them will be probably anti-vaxxers, of the ones that will not vaccinate their kids no matter what, but also many of them are probably people from like my community, like Indigenous and Latinx community, Black communities, who just don't have faith in the system because they have never, a system has never built for us. The system has not opened their doors for us. We are treated badly when we go into the doctors. Many of them don't find family doctors. So some people, it's not that they don't want to get the vaccine. They just don't have the information that they need in order to make that choice. And they probably just need someone from their own community to sit with them for 10 minutes and they will book a vaccine appointment. So it's not that they are anti-vaxxers, they just don't have enough information and the information is not accessible. I don't have a TV, so I don't have a TV at home. We don't have a TV at home. And I don't think I have seen, if it's not for the radio once in a while, I don't think that I have heard any information about vaccines, what they do, how to access them. And I have no idea how it's spreading the words about vaccines. The only reason why I know and I have access to vaccines is because I check Twitter and I check Facebook and I like hear the radio and I can manage the website and I know how to book my vaccine, but many communities don't have that access. So it's a combination of not trusting the system, but also not having the access, still not having access. I have seen very successful very successful campaigns in some communities, like the indigenous and Latinx communities have been like very like beyond. Many community organizers have gone beyond their capacity to try to get and make as like almost sanctuary vaccination clinics in order to protect everyone who goes there, to like receive them and have doctors that they can speak to in their own languages, in very specific and targeted communities where these communities, they are like a higher population of these communities. And I think that has helped. And in terms of the youth, I honestly just think that we need probably vaccination clinics at schools during school time, not even after school. Just go outside of school, and I'm sure the youth will do it, because I think that youth have demonstrated that certainly more open and have more knowledge about vaccine, that probably less hesitancy that groups from older ages. And I don't know if we can change the system. I don't know if we can change the health system in order to make it more worth of our trust. But what we can do is we can support the people from our own communities in order not even to navigate the system, but like make kind of like different spaces for them.
Well said, Fernanda. So well put. And thank you for speaking truth and busting one of those myths specifically with regards to youth and their level of participation in the vaccination efforts. Those numbers are amazing, and it speaks to the work that needs to be done to actually challenge other age groups and other specific communities by resourcing and supporting that educational awareness of the impact of the vaccine. But I want to see if Dr. Candice Todd or Trevor have anything to add to this very important piece. We're talking about how COVID-19 has disproportionately affected poor, disabled, and working class communities. We talk a lot about essential workers and how important they are to our economy, how vital they are. But the data reveals those are the communities deeply impacted by COVID. So is there anything that you want to add, and specifically, how we can best address this conversation with an emphasis on, what advice you have for folks who are supporting community members?
Yeah, I mean, just a couple of things fairly quickly. And first of all, one of the things that was quite noticeable when you go back and look at when we started getting the data and looking at communities that were, looking at vaccination rates in various communities, the picture became very, very clear. So the communities that were having problems, and we're talking about some of those communities now again. And so the issue was that because we know that those communities had the so-called problems with the determinants of health kind of thing, the social determinants of health. We know that was a real issue in many of those communities. Like you said, people who are, working 2 or 3 jobs or whatever, or working the so-called jobs where they were indispensable, for example, or so those are kinds of situations, or people who were living in crowded conditions or whatever the social issue was. But we knew that those are factors in those communities. So one of the big misstep, I think, initially was not targeting those areas more initially, because if we had focused more on issues within those communities and figuring out what it was that needed to be done, we could have prevented a lot of infections, I think. But anyway, that's past. So where we are now is trying to understand what's going on in some of those communities still. And we know that there's a hardcore of anti-vaxxers, or people who have, who probably won't ask for a vaccine until they're on their deathbed, like we're seeing many other people do down in the US right now. So we have those issues. But apart from that, it's trying to understand what are the profiles of the people who are there, who, as was just said, a lot of it is access, but access in a number of different ways that we probably don't really understand fully. For example, I was looking at a little update on TV just a couple of days ago, and there's a lady who came, an older lady, to one of the clinics that had been opened in an area that was not too far from where she was living. And her complaint was that, she no longer had a family doctor, and so she didn't know what to do about getting vaccinated for the longest time. And it's just coincidental that she stumbled across the fact that there was a clinic that was going to happen close to her, so she just went and had her vaccination. So there are all kinds of issues like that. It's not that everybody's anti-vax. It's just that access or priority. I can't take time off from my job or things like that. So the struggle now is to how do you bring the vaccines to people more than telling them where to go and get the vaccine. Those kinds of issues, I think, are paramount. But we still don't have, like what I was saying at the beginning, is trying to get a better handle on what are the issues that people are saying that they really do have in various communities that we can probably help them with. Because nobody wants to go in there and try to, pretend that we know what's going on. You don't live in the community, you may not have a great understanding of what's really going on in the community. So it's really important to kind of get that information out of the community so that if you feel okay, so if that's what your problem is, maybe we can do something about that. But we're never going to have that hardcore group of anti-vaxxers in the end. But anywhere between that and anybody who's willing to get a vaccine today, there's probably a whole lot of things to work on.
Excellent. Thank you so much for that response focused on how to best support folks who are looking for that vaccination.
Sorry, can I just say one more thing? Can I say one quick thing?
Yeah.
And I think that was also mentioned before, and that is, the amount of misinformation or disinformation is unbelievable. And a good example of how that works is, there's some reports coming out of the US just this week. There's a whole bunch of people somewhere down in the South been taking a drug called ivermectin that's used to deworm cattle and horses, and and somebody told them, no, that's good for your COVID, and that's what they've been taking, and they're all in the hospital then. So that's how disinformation or misinformation can hurt you. So there are lots of good sources of information. It's not hard if you really want to find good information, but it's just too easy to get misinformation. So I would, one of the things I would suggest is that you could get people to be a little bit more careful about who they're prepared to listen to for health information. That might be a good start.
Well said. Thank you, Trevor, for highlighting the disinformation that's actively impacting folks. Candice, I was hoping maybe you could help us dig a bit deeper because we did talk about the impact on BIPOC communities, on the most marginalized members. And there's been a lot of talk about mandates, vaccine mandates. And I'm just wondering, from a public health perspective, as a doctor, someone who is invested in ensuring that we have a public healthcare system that works for everyone, because we all understand the stresses this pandemic has caused on the system. Maybe you could tell us more about your thoughts about mandates and the vaccination conversations that we're having with regards to the employers' roles in these spaces to ensure that folks are protected.
Sure. So from a public health perspective, I totally understand the talks about mandates, especially in light of all the, again, misinformation, disinformation, and the numbers. So where we're seeing like low vaccination rates. So I completely understand it, but I also am a proponent for informed decision making. So I think that people should have the right to make the decisions regarding their own health and their own bodies. That said, and what I wanted to sort of touch on with respect to the last question, and sort of like the historical mistrust with the medical system, I think it's really important for community members who are, sort of working on the grassroots level to acknowledge that there has been all of this, mistrust with the medical system for these marginalized communities, acknowledge that we're at a disadvantage, and, really weigh your own risks when it comes to getting COVID. You definitely don't want to have COVID. I've had COVID 2 times and it wasn't a great experience. But it's really important to acknowledge the mistrust and know that vaccination is one of the ways, one of the tools that you can use to protect yourself and protect your community. So, you know, as a naturopath, I always talk about holistic health, but the reality is that because of some of the social determinants that Trevor was speaking of, we don't have access to healthy food all the time. We don't have access to, you know, the time to exercise or resources to support anti-stress or our mental health. It's just not always there. Those are the things that help to protect us from an immune perspective and help to keep us healthy. So, you know, it's just not accessible all the time. And I want people to sort of think in a holistic perspective that, you know, along with doing all the things, so healthy eating, making sure you're getting adequate sleep, sleeping at the right times, managing your stress, exercising, that vaccination is something that you can include as a tool, as a resource to support your protection against COVID-19. I do want to say, though, that again, as a naturopath, there is nothing out there that is going to stop you from getting COVID or protect you in the way that the vaccine can. So I know a lot of people talk about, you know, let me just take this ginger or let me just have some turmeric and I'll be fine. But the reality is there is no evidence to support that in the way that the vaccine can. But it's also not a this or that thing. All of those things can be included in protecting your health.
Well said. Thank you so much, Dr. Candice Todd, for that response, articulating the importance of folks understanding that, you know, the vaccine is effective, but there's also other solutions and your position on mandates and why that conversation is important. So I just want to encourage folks who joined this. We've got about 41 folks who are part of this amazing conversation. If you have any questions, please put it in the chat and we'll make sure that those questions are addressed. I am going to start our Q&A that's basically going through some questions that we've received from community members. So we'll start off with the first one, and maybe you know, this is for everyone on the panel to think about, but this has been, how would I best put this? Out there in social media, specifically, not just youth, but there's been a lot of talk about the risk of infertility or damaging the DNA because of the COVID vaccine. So what I was hoping maybe we could do is we could get started with at least understanding what's in the vaccine. What's the difference between the DNA and mRNA vaccine? Maybe that's the next thing that we want to explore. And then start talking about some of this myths, you know, with regards to infertility and DNA alteration and other things that folks are talking about. So if any of you folks would like to just quickly answer the first question, is what's in the vaccine? And then maybe we could start talking about the differences between the DNA and mRNA. Who'd like to go first?
I can start it too. Okay, so before I even talk about the current vaccines, maybe just a quick reminder or maybe new information what the old traditional vaccines looks like. So all vaccines basically are, your starting point usually is a pathogen, which just means a bacteria or a virus or something that causes diseases. So, but in the traditional, I mean, I spent, you know, a long time working on vaccines like this, and that is you start off with a pathogen, the bug, if you like, and you use that. I mean, you carefully curate that bug and you keep it safe because that's what you're going to use to make your vaccines for a very long time. And so what you do is you actually, you know, you keep growing that up and making large quantities and large quantities in terms of volume, but not necessarily large quantities in terms of what's active, because really when you go through these processes, and you're making huge 5,000, 10,000 liter volumes of these things, what you're getting out of them is just a few grams of some active material. And basically, it's a very complicated process to grow up a bacteria, cultivate a bacteria or a virus, separate it out, purify it. It's really not simple. It's very complex, and it takes a very long time. So this contributes to some of the long lead times for the traditional vaccines. And many of the vaccines that you get more recently, they're not just single, if you like, disease vaccines, because I mean, to be more efficient, what we're trying to do is have multivalent vaccines where we're attacking several diseases at the same time. So if you look at a lot of pediatric vaccines for children, you would have, say, something like pertussis, you may have tetanus, you could have diphtheria, all in one bacteria, things like that. So it's the traditional vaccines processes, it's difficult and it's complex. With the new vaccines, it's a much more elegant process, and certainly right now with the mRNA vaccines, I'll talk about that a little bit. So in the old case, you actually use the actual bug to make your vaccine. In this case, what we've done is we have identified, and every vaccine requires you to identify an antigen, something in that bug that you can trigger an antibody response to. So in the case of the SARS-CoV-2 virus, what we're triggering the antibody response to is that spike protein. Everybody's seen the picture of the spike proteins on the surface of the virus. So that's what helps the virus to get into your cells. So what we've done is we've said, okay, the spike protein is going to be the antigen. We're going to target that. And so what the mRNA vaccine does is what we've done is identified that little piece of messenger RNA that codes for the protein that makes that spike. And that's what it is. So, and what we do is now, okay, instead of going through the whole process of using the virus itself, we just use the code for that protein. And that code is once you've identified what the code is for that protein, it becomes just an industrial process. You don't need the bug anymore. You can actually synthesize that piece of protein using that industrial process. So that's what the mRNA, that's one of the big differences with an mRNA vaccine. It's a very simple, elegant process once you know have all that information. And so
Trevor, the way I understood it, when someone told me about the mRNA, it's more like it's a hack. It's like a sophisticated hack. That's how I took away from it. It's
sure.
Like you are able to do that and not use.
Yes.
So
that's right. So what you do is all you do is now you make messenger RNA that codes for that spike protein. And when you make that messenger RNA, that becomes your active vaccine ingredient. And the formulation of that vaccine into, say, an actual vaccine product is fairly simple. One of the trick to doing that is you probably heard about nanoparticles, lipid nanoparticles. So the messenger RNA is fairly fragile. So what you have to do is you have to put it inside of this lipid nanoparticle so you can transport it to your cell. So once you've designed the process, and it's a much simpler formulation than the old traditional vaccine. So inside the messenger RNA vaccine product, you have some sucrose for stabilizers, some lipids to support the mRNA, and some other components that are really just buffering, keeping the pH of that vaccine stable. So it's not a very complex formulation. The only thing in that formulation that has been any concern is that there's one or two components that some people may be allergic to. And one is a thing called polyethylene glycol. If you go into your cupboard and look at all the cosmetics that you have, you will see you have lots of things in there that contain polyethylene glycol, for example. So it's not a very complex or unknown product. So anyway, it's a simple formulation. So the hack is that you just, your injection is of messenger RNA. Your messenger RNA sort of short circuits the process because the messenger RNA, once it's injected into your cells are constantly making proteins. But the way your cells make proteins is it starts off from the DNA in the nucleus of your cell. And that DNA now translates the message to make protein by sending some messenger RNA out into your cell to a little protein factory in your cell. That's what the messenger RNA does, the same thing, except that you inject the messenger RNA, goes into your cell, it goes right to the protein factory and makes the spike protein. So that's the hack. And once the messenger RNA makes that spike protein, it's very short-lived. The cell cleans up whatever what's rubbish in the cell and gets rid of it. But you've already made the spike protein. That spike protein now, when it's made, it just moves to the surface of your cell and triggers your immune response. So it's
Well said.
It's not overly complicated, but it's it's just really kind of getting a sense of what happens in your cell when that happens.
So there's nothing for us to be afraid of. There's nothing in the vaccine that's dangerous, except if you have an allergy, right?
Well, if you have an allergy to say which is rare. I mean, I think there's probably only 1 or 2 people that we've seen that there are a couple of people who have had some allergic responses, and it's not unknown to have allergic responses to vaccine. That's certainly not, but it's relatively rare. But so it's not really the biggest problem. So that is one thing. And some of the other vaccines, it's also not rare to have blood clots due to vaccine, but we've seen a few more issues with, say, the AstraZeneca and the Johnson & Johnson vaccines. But it does happen, although it's relatively rare. So once you inject the vaccine, it just follows the process that your body uses to make the spike protein. Your body just makes the spike protein once you inject the mRNA in, and that's it.
Awesome. Well said. We're talking about some other myths, and Fernanda, I would love to get your opinion on this, and Dr. Candice Todd, about fertility. Women fertility. What are the other side effects, right? So let's unpack that as well, right? It's important for us to clear this information. So Fernanda, you want to go next, and then maybe Dr. Candice Todd, right?
Well, I honestly, other than I don't think that's true. I don't know, because I'm not the doctor. But I was just like listening to Trevor make me think of a question that someone asked in the chat. Is like, how can community members and organizers, what can we do in order to help combat misinformation? Because I agree, I don't think there is like so much hesitancy among our own communities. It's just not enough information. And when like the COVID vaccine came, I'm like, I don't think I'd even ask what it was, like what it had. I just like went and got vaccinated because that's what we do. That's what we're supposed to do. But listening to Trevor and what he's sharing, I think it was probably the first time that I had someone like literally just breaking down the information for me. And I think I just learned now, Trevor, more things about the vaccine that I have heard up in the last 6 months. I did not.
Well said. I agree too. I agree.
I didn't know those things, and I think that's what we need to have in our communities. I don't see posters out there. Like I don't listen so much to radio. I don't see that. I don't look at the TV, and I don't think there is this time that we have taken, maybe even with other community members, to like just explain and see it. And I think that's what we need. Maybe we need tables in parks, outside of buildings, when people it's not about getting people vaccinated, but just providing with information so they can make the choice if they think that that's what they have been told is the right fit for them. Like I also have a father, like my grandfather, who like last year or was it this year? I can't remember, for like 4 months, was actually taking that medication that Trevor was talking about in the US. My grandfather, and I had to call him every 2 days to just beg him not to take him, and he will take a pill of that medication every week because he was convinced that will protect him from COVID. So I think what we need is just more information, and that we can share as community members to other community members, because that's the voices that they will trust. That's like at churches, at like community centers, in like women's groups, like every opportunity that we have, not to like even ask people and carry people to get their vaccines, but just to like give them the information that they need in order to make that decision. And Trevor, thank you. Like I honestly did not know all that about the vaccine.
Well said. Thank you so much, Fernanda. And I share that sentiment. Trevor, thank you so much for educating us for the first time what's in the vaccine. And just like Fernanda, I actually got to learn what's in the vaccine, and it speaks to the gap that exists in public education, especially when folks don't know what's in the vaccine. And let's remember the point that Fernanda made. It's not about hesitancy, it's about respect. People want to know what's going into their bodies. So Dr. Candice Todd, maybe you could tell us about this fertility question that has been raised. Does taking the vaccine make you infertile? And does it have an impact on different genders, male or female? Let's unpack that question.
Yeah, so definitely. So, okay, I have seen in my own practice and with my own self that, there have been potentially changes to your menstrual cycle. So whether it's like your period was a little bit heavier after you got vaccinated, or you had a little bit more cramping, I have been seeing that more in practice and have experienced it myself. So I think that, along with a lot of the misinformation or disinformation that has been circulating, sort of fueled this idea of infertility. So of course, there were studies done on it. So what has been noted is that there are no differences between vaccinated and unvaccinated people with respect to ovarian reserve. So that's how many eggs that you have, ovarian quality or egg quality. So how, how quote unquote good your eggs are, miscarriages or pregnancy rates. So I think we can sort of throw that out. But the reality is it's not affecting fertility rates. And also with respect to your periods, those can actually fluctuate very much so month to month, with very small things. So things like stress, for example. And if you can imagine being vaccinated, it's a stressful thing inside of your body. So your body is mobilizing all of its resources to, create this immunity, and it's a stressful thing that's happening in your body, whether or not you feel that stress outwardly or not. It is creating a stress response. So there's that might be happening, but essentially with respect to the periods themselves and like the changes in them, they were very transient when the data was collected. So transient changes that corrected themselves by the next couple of periods, and then again, no effects, no discernible differences with respect to fertility.
Excellent. So the vaccine doesn't stop any of us from having babies for natural reasons. Thank you. Trevor,
Yep.
maybe you could help us unpack the question related to blood clotting. So could you help us why some folks get this condition, blood clotting, when it comes to the vaccines? And is it, like you mentioned earlier, AstraZeneca and Johnson & Johnson DNA related vaccines, there seems to be some evidence that some people, and maybe you could share the data, like what percentage, of those folks that get blood clotting, or how rare is it? That would be great. So we could have better understanding of what blood clotting is, and why do some people experience it.
Okay, so I'll tell you what I can remember right now, but it's a phenomenon. It's called VITT. It's vaccine-induced thrombocytopenia. It's not unknown for vaccines, right? That's why it's called vaccine-induced. But it's very rare. It's not, in terms of how things, understanding the phenomenon, I can't give you a lot of details. What I can tell you, though, is that there is a group out of McMaster University that has been studying it, and I think they have some answers now. They have a fairly clear picture of what the direct cause may be, and this information is going to be more useful in terms of someone experiences this, and for treating someone who has it. It's not that it's. I mean, I think there have probably been a few cases where there might have been a few deaths because of it, but it's certainly something that can be treated if it's recognized at the right time. But yeah, it's not really unexpected for us to have it occasionally with a vaccine. I mean, and it probably, don't know if it has anything to do specifically with someone's specific metabolic processes, but it could be, because it's very rare. It seems to affect certain people, and that's really what it comes down to.
Excellent. Well, I want to go to other questions, but I do want to take some questions that we received from some of our participants today. So from John Alexander, question: how can we leverage the mutual aid movement or neighborhood pods to encourage people to follow public health advice? For example, vaccinations. Does anyone have stories about things that worked or succeeded? So again, I'll ask the question: how can we leverage the mutual aid movement or neighborhood pods to encourage people to follow public health advice? For example, vaccinations. Does anyone? So who would like to answer that question? And I can also provide a response to that one. Would like to go first?
I can go. I'm not.
Go ahead, Fernanda.
I don't think mutual aid pods should put on ourselves the responsibilities that the government and that public health should have. I find it really hard because it's like many of us, we don't have the resources, we are volunteers, and I don't even manage a mutual aid, but I'm just speaking in like plural and another person. But I think it's hard for us to take on a big responsibility that is actually a public health responsibility. What we can do is we really just maybe have little efforts of like the needs that each community may have, that it might be different. In some communities might not be vaccination, and it might be something else that would allow people to like get through a pandemic, and that will allow certain areas to live like with dignity throughout the pandemic. And my vaccination might not necessarily be that. And it might be among the youth, and others might be among seniors, and others might be like the opposite you're trying to get people vaccinated, but it's like actually the priest in the church who's telling people not to get vaccinated. And it doesn't matter what you do, they probably trust the church, the priest more. So I think that I would probably think about the best way maybe is like to assess and see what are the needs, and maybe try kind of like what we did here, like have conversations about just the questions that people have, whether that's about vaccines or about housing or about rental or about disputes, about encampments, about like anything that the community are dealing with. Yeah, that's probably what I'm thinking.
Well said. Thank you, Fernanda. Does Trevor or Candice, do you want to add to that?
Just maybe one aspect, because it's kind of interesting, because it's really hard. This whole experience of going through a pandemic. I mean, this is nothing that any of us have been through, right? It's a very rare thing to go through in the first place. But the impacts are kind of obvious too in many different ways. It affects different people in different ways, but most people have issues with how is it affecting you? Because it's almost like having things put on hold, and we're trying to come up with the right term for what's going on. And the term that keeps coming up quite often is that we're just languishing. We just got almost like you're waiting for something to happen, and you're not. But certainly having a vaccine was certainly one of the major hurdles in terms of waiting. What are you waiting for? But we're still waiting to see, for things to come back more to normal. So associated with all of that is probably some mental health issues. A lot of people are affected by depression, loneliness, all those kinds of factors are out there too. And I suspect that, at some point we're probably going to be hit with a huge wave of PTSD after all of this is done. So I don't have any answers for that, but I'm just saying this is kind of some of the things that I'm seeing. For example, I live at Young south of Eglinton, just between Eglinton and St. Clair. And sometimes I'm walking down the street, and all of a sudden there's somebody in front of me on this, I've seen it several times. People are just literally stopping in the middle of the street and bawling like a baby. And what the hell is this? Is this it seems like it's a pandemic thing.
I've seen that too. Right?
Yeah. So, you know,
Trevor, thank you so much for talking about the mental health, piece to this conversation. We sometimes forget the impact of the pandemic on our mental health, and specifically post-traumatic, PTSD. And that conversation hasn't even been unpacked. So hopefully we'll get to a part 2 of this at a future date, to think about that. But I want to ask Fernanda and like also Candice to weigh in and on Trevor. A question asked by one of our participants, and that is, do you think that the public or families are ready for young children aged 2 to 11 to get vaccinated against COVID-19, as the studies are projecting that they could be ready as early as late September or early October? So Fernanda, what is your opinion of that, as someone who's been on the front lines, advocating for parents, advocating for children? What are your thoughts about that?
Every time I hear or like I read news and the headlines of what's happening in the US, of like just seeing how many, pediatric ICUs are like full at their maximum capacity with kids who are like very ill, it just brings me to tears, because like I cannot imagine anything. Like I lost people in the pandemic, and I cannot imagine what it will be to have like one of my kids in that situation. And I think for many people who have stood up like at the beginning when when the vaccines were available for us, they will step up and they will like get their kids vaccinated. But it's a hard decision, because it is like the same. It takes a little bit of time to trust and to know what is it, and is it the right amount, and is the kid going to be okay, and there going to be side effects. So it's going to take a lot of efforts to really communicate parents about the process, about the vaccine, about the side effects, about the benefits, in order to make that decision. I think my hope is that we're ready, and I think we are. I mean, the doctor is predicting, the main doctor in Ontario is predicting he say a hardfold. And I'm assuming that will be connected at some point with the schools. So my hope is that parents will see that and will see the effects, and will, when the vaccine is ready, they will take their kids, because I think it will save lives. It's just not about not getting COVID. It will save children's life. And I don't think there is anything more painful than seeing your like 5-year-old, 6-year-old, 7-year-old dying from a totally preventable disease. Not disease, but the condition. So I hope parents will be ready, and most parents will be ready.
Fernanda, before we get you to answer some of the question, what can community members and organizers do to help combat misinformation or disinformation that will have an impact?
I honestly have given up on like some of the anti-vaxxers that spread misinformation, because it doesn't matter what you do, they will keep doing it. It's like the people who stand up outside of the abortion clinics. It honestly is like a lost cause. It doesn't matter what you do, they will keep doing the same every year. But I think with other communities, it's just congregating, is just like getting back in the community together, and whether that's in parks or whether that's at schoolyard, like just talking to people. Like I think people just need someone else to talk to, and I think that will help. Opportunities for people to meet, opportunities for people to connect, opportunities for people to help one another, and to strengthen that just human connection that we have among like members who care about each other and care about one another. And I think
Well
that's
said.
probably what will be helpful.
Well said. So as an advocate, do you believe if the vaccine was made available next month or October to folks who are from 2 to 11, children as young as 2 to 11, will parents be receptive to make sure that their children will be able to access the vaccine?
Oh, sorry, that wasn't for me.
Yeah. It was for you.
It was
Yes.
for me. I think, as I say, I think the ones who had been ready for themselves when it was available and they became eligible, they will vaccinate their kids. And for those who will need more time, it will take longer. Then the ones who want to have more information, it will take longer. Many who have lost families will probably, do it right away. And the ones who didn't get vaccinated themselves, they probably won't vaccinate their kids. But it will take a long time. It will probably take us through the whole, let's say that the vaccine is available in, I don't know, October, November. I think it will be a couple of months until parents really receive the information that make them feel okay about the safety of their kids.
Excellent. Well, our next question, some context. The Federal Drug Administration Agency, this is an agency based in the United States, just recently finally approved the Pfizer vaccine for 16 and over. I'm not sure if it's 12 over or 16 over, but the fact that it's approved shall give folks some comfort that there's been a lot of studies that has been peer evaluated leading to that decision. So I have a question to Dr. Candice Todd. Are there any permanent side effects to COVID-19? Are there any permanent effects, neurological, your lungs? Like, what do we know about COVID-19, specifically with regards to whether there are permanent effects to getting COVID-19, and what sort of remedies exist?
Sure. So I think that we, sorry, I lost my train of thought for a second. With respect to long-term effects, what we're seeing is that there are some long-standing effects that can happen if you do get COVID. What I'm seeing the most is lung involvement, so things, permanent sort of lung conditions that can happen. Some are benign, things like wheezing, but can escalate into greater things. I'm also seeing a lot of long-standing inability to smell or taste. So those are some of the longer term things that are happening. I think that the data is still being collected. So whether those things resolve eventually is still yet to be known. But those are some of the things that I'm personally seeing.
Well said. Thank you, Dr. Candice Todd, for speaking to some of the impacts. We don't know if it's long-term or short-term. And I would not want to lose my senses, especially smell. I love smelling flowers. I mean, life would be very boring without smell or taste. So I want to encourage folks not to in any way expose themselves to this very dangerous novel virus. And what I want us to do next is to actually dig a bit deeper when it pertains to the vaccine, and specifically, the booster shots. Trevor spoke about the importance of receiving booster shots for those that are immunocompromised. Those folks that we know the antibodies will need that additional boost or support to keep themselves healthy. So maybe you could help us better understand who qualifies and who doesn't for this booster shot. And also, when it comes to, documentation, that, some public health experts might require. And there's actually an interesting question that was raised by Ashley, who wanted to follow up about advice that may be given by healthcare professionals regarding that the vaccine isn't necessary due to the natural immunity. Have you heard of your colleagues letting patients know that they might not need the vaccine and that your natural immunity is more than sufficient? So maybe we could dig deeper on who qualifies for the booster shot, what documentation are necessary to advocate for patients who need that booster shot, and if there's any truth to natural immunity in response to the COVID, and whether vaccines are actually necessary. Who would like to take that on?
I can start that going. So first of all, of course, if you are infected with the SARS-CoV-2 virus, your body will respond to it. Your body will produce antibodies. But in most cases, so when you get infected by a virus, for example, the level of infection you get is proportional to the amount of virus that you've been exposed to. You can experience some virus and get past it without too much trouble. And a lot of people do that every day, so it's not surprising. But in terms of having a real virus infection that knocks you out, kind of throws you down, your body in most cases does not mount a sufficient antibody response to a serious case. So that's the reason why you get a vaccine. So those people who have not had a vaccine and have been infected and who end up in ICUs and beyond that die because their body could just not deal with it. So that's the purpose of why you have a vaccine. It gives you a much stronger antibody response to the virus. So that's the first thing. In terms of what does it mean to have a booster, there are two things. One is actually just getting your immunity level boosted because it's waning for one thing, or you just didn't have it high enough in the first place. And the waning we talked about a little bit before, because it's just a natural loss of immunity over time based on when you got your vaccine. But the other aspect of boosting, which we probably haven't seen yet, but the vaccine companies are prepared to do that, is especially for the mRNA vaccines, is depending on the strain. Some strains that may develop that we may need to have a specific version of the vaccine to boost you for that strain. So that's still out there in the future. So, but in terms of how will we deal with this? This is just going to be a policy decision, and the people who have the best overall picture of what it looks like in terms of what is the profile of experience with well, you have to do studies to look at what's happening with people's antibodies over a large enough group to understand what might be an appropriate way of applying the need for booster. I mean, in general, it looks like there's no urgent need to do boosters for the average person based on the level of immunity that we see. But obviously, we've seen also that. And not necessarily from our own studies, because like I said, we're seeing some of those studies coming out of places like Israel, and Israel seems to be pretty far ahead in looking at things like that. They were the first country to start talking about boosting as far as the stem, because they were seeing the impact of waning antibody levels on immunocompromised people. But these are going to be policy decisions. So, I wouldn't even try to suggest what we do about that, because it's going to have to go through some pretty exhaustive scientific reviews, looking at a whole bunch of data that's suggesting who and
Who's
when.
eligible.
Who is eligible and when.
When.
I think,
exactly.
For example, right now, in the US, they're using some rough guidelines of 8 months after you had your second dose. You could be boosted, but I don't know. I didn't see the data myself, so I'm not sure how they made that decision. But that seems like it could be, an approximation of what we're seeing in terms of looking at where antibody levels are after your second dose. Yep.
Well said. And actually, Dr. Candice Todd, I don't know if you want to weigh into this as well. This question is more focused on, I'm trying to catch it here, specifically people who are taking immunity suppression medication due to HIV. Are they able to get the vaccine? And someone asked about clients who have MS and whether they're unable to receive the vaccine. So maybe answering that question.
Yeah, I think this is maybe a Trevor question.
Trevor, go ahead.
You're on mute.
I'm a little bit hesitant to answer that, because for me, that's more of a medical question.
Yeah.
Yeah, you want to get, we don't have any of the medical doctors with us today, but I would rather get an opinion from them on that.
Excellent. Thank you so much for that. The other question that we have is specifically with regards to the difference between coronavirus and COVID-19. So what is the difference between coronavirus and COVID-19? And two, does COVID-19 have a cure? And if someone has COVID-19, is it a list of disability? Can it cause a disability? And what's happening about the future risk of survivors? So basically, folks want to have an understanding of distinction between COVID-19 and coronavirus. I will answer it's the same thing, but go ahead.
Well, okay, so COVID-19 really is just a name for the disease that you have when you're infected with the SARS-CoV-2 virus. They're all related viruses. It's just that some have different levels of virulence and they affect you more seriously than in other cases. There are other coronavirus that have been around and have not been seriously affected by them, but still for the SARS-CoV-2 viruses. And you remember we had SARS back in 2002, 2003. So we know that SARS could be an issue, but it certainly wasn't as serious as this time around with the SARS-CoV-2. So that tells you that you have varying degrees of virulence and impact on your health, and in terms of making you more ill, and also various degrees of infectivity. Because even though we had SARS, and in fact, a lot of work was done on the mRNA, developing mRNA vaccines around that time with the original SARS outbreak that we had back in about 2002, 2003. So, the differences they belong to the same family, basically, but it's more a question of, do you have more virulence? Does it affect your health more? That's really what we're looking at in terms of differentiation. And so, whether can you survive the COVID-19? Well, obviously, because we've had probably millions of people who have had it and have survived fairly well, but some have not done so well. We have the long haulers, we have people who end up in ICUs, and you don't want to get to that stage. For most people, it probably doesn't impact them more than, say, a serious flu or something. But because it's so infectious, especially now with the Delta virus, you run the risk of having a much more serious illness, and also the actual transmission of the disease is probably heightened because of this.
Well said. Thank you so much for that response. So one of the things that I want us to quickly talk about and profile is the contributions of Black scientists in the development of vaccines. A lot of folks forget that Black people, Black scientists, Black minds have been part of finding cures and medical innovation. And there's actually been an amazing podcast by CBC focused on some of those Black scientists that I shared with the panelists. So what I'm hoping to ask all of you folks is, you folks are Black professionals in the medical industry, or Fernanda, you've been supporting parents, as a member of the visible minority here in Canada. So how can we best tell those stories about the contributions of Black scientists and BIPOC members of the community that have supported the important innovation in science, and also helping find the cure to COVID-19? Sorry, Trevor, you're mute. Go ahead. And Candice, you're also welcome to contribute.
Yeah, there's a member of our task force. His name is Francis Jeffers, who focuses on the historical aspects of this. Might be good to talk to him. So I can send you his coordinates. But in terms of the current situation where we are, one of the people that we should talk about is someone who works for the National Institutes of Health in the US. Her name is Kizzy Corbett. She did an incredible amount of work with Moderna on getting the Moderna vaccine through the last big hurdles. I mean, she's a young woman, brilliant scientist. I mean, someone probably didn't sleep for 2 years. but she got it done. And I mean, I wouldn't be surprised if there's some huge award for her in the near future. So her name is one I think would be important to highlight whenever you can. And you can just look in.
Sorry, Trevor, we can't hear you.
My mute keeps going on automatically. So I'm saying there's a lot of available information around Kizzy Corbett, who works for the NIH in the US. And that's a really good source of information to talk about the current situation with the mRNA vaccines.
So I just posted just a Wikipedia page on Kizzy. Maybe not the most reliable evidence, but just some clarity on who she is, and it'll list some resources on more information about her.
And we'll also share that link to the CBC podcast with regards to Black scientists on the chat. Just going to ask one of our volunteers if they will be able to do that, so that our participants are able also to look at that resource for Black scientists that have contributed to medical innovation and vaccine development and finding medical cures. So thank you so much for that. So we're now going to move on to the next important part of this conversation. And I'm actually going to ask my colleague to talk about how we can collectively take action. And for those participants who want to get involved in this very important conversation, what actions they can take. I believe we're also going to be sharing some resources on the chat that folks can look at, specifically the Ontario website, ontario.ca COVID-19 website that has some frequently asked questions, and also the toronto.ca website. So I'm not sure if it's been included in the chat now. Just want to prompt my friends here to include that in the chat. Thank you, Joey, for including the CBC radio link. And could we also share those resources? There's also one from the Black Scientist Task Force that we're going to also be sharing on the chat for people to look at while we have this important conversation. So my friend, do you want to take us to the next segment, which is taking action? I'm going to call on, when do you want to do that? Fumi, you ready? Okay, so we're going to go through the section that's focused on taking action.
Hi, everyone.
Go ahead.
Can you hear me? Because my internet is very unstable. It's been telling me that the whole time.
Okay, go ahead, Charlene. Go ahead.
Okay, perfect. Good evening, everyone. Thank you for coming out to our event. My name is Charlene Henry. I'm a mutual aid coordinator in York Southwest and Pelham, which is right here in Toronto. I live in the Weston Road neighborhood, and I've been involved with the project since January. I'm just going to talk to you a little bit about my experience as a mutual aid coordinator and how you can get involved in your community. How I became involved with mutual aid was through tenant organizing. I'm a part of the York Southwestern Tenant Union. I'm one of the co-founders of that tenant union, and we advocate for tenant rights in our neighborhood because we were going through regentrification in our neighborhood and saw a skyrocket in rent for all residents of the neighborhood, which we were one of the most affordable neighborhoods in the city, and we became an expensive neighborhood. So we started advocating for tenant rights, for maintenance in our buildings, and started tenant unions in various buildings across our, basically our city council riding of York Southwestern. Getting involved with as a mutual aid coordinator, I realized what we were doing was part of a bigger picture in the city. We were helping many other grassroots organizations, help people. That's basically what mutual aid is about, is neighbors helping neighbors. Many countries do it historically in the Caribbean and in many places in Europe and Africa. Neighbors help neighbors. They take care of each other's children, make sure everything's okay when they're away, things like that. And during the pandemic, we realized that as a city, we need to come together and help our neighbors, make sure that they're okay, make sure that they have food in their refrigerator, make sure that they have access to anything they need, be it the internet because the library is closed and they don't have a computer at home, be it that food security, helping someone get a hot meal, or even just getting to a COVID clinic for a test. So being part of this project has been very eye-opening to see what is needed in our community and how each community across the city is very similar, no matter if it's downtown to Northweston Rexdale or right here in the Weston area, we are all the same. We all need some sort of help and connection with our community. So right now our focus is on helping people get educated on vaccinations. Should they or shouldn't they? That's the big question going on in the city right now. We hear every day on the news about this many % of people have been vaccinated, this many % of people have not been vaccinated. But as our panelists have talked about, education is the key. So we are right now involved in helping educate our neighbors on should they or shouldn't they be vaccinated and helping them do different projects. In my neighborhood, we have a couple of pods where we do Humber River cleanups once a month to help clean up the parks that people are using so much during this pandemic. Another project a young Indigenous lady started was a garden in her building for people to have access to fresh fruits and vegetables. Those are just some of the things that you can do to get involved. As I said, I'm here in York Southwest and Pelham, but we can reach out to any of us mutual aid coordinators on the call today. We've all put our information in the chat, and to connect with us, and we can help you start a pod where you see there's a need in your neighborhood, because every neighborhood has a need, and we need each other during this time to get through this pandemic and become a stronger city. So yeah, that's my spiel. I believe that all the information about neighborhood pods, TO, will come up in one of the slides for you to become involved if you choose to, and can also reach out to any of us in the chat for more information. Thank you, and thank you for this event, and a huge thank you to all the panelists. It was very educational tonight.
Thank you, Charlene, and thank you for speaking to what a mutual aid is and the importance of starting a pod and joining the NP, the project and the impact it's had on you personally and through your lived experiences. Thank you so much. We want to talk about the next events that are upcoming. So if folks could look up the screen, there are a couple of community events, and I just want to welcome Shahanara. Shahanara, do you want to quickly briefly talk about the upcoming August 31st event?
Yeah, thank you everyone. I'm Shahanara Khandakar from Downtown East, and I'm the mutual aid coordinator for the East End, and I live in Regent Park last 11 years. And I'm so happy to organize and support mutual aid project in the Downtown East. And I would like to invite you all. I'm doing a follow-up session after this event on 31st August, Tuesday at 4 p.m. And I will send you my flyer and event details by the end of the tomorrow. And I would like to get all of your advice and suggestion, and committee members would love to hear from all of you. And we will share this recording with our committee members. And my theme would be for the event, like kind of same thing like mutual aid, fourth wave, and the vaccine hesitancy, those things. And I'm really learning so many things from you guys, and I would like to sincere thanks to all of you. Thank you.
Thank you, Charlene. So thank you, Shahanara, and Charlene earlier. Do we want to hear from Fumi next about the next event? Fumi, do you want to go?
Yes, thank you, Walid. Yeah, I am Fumi Adibanjo. I work with the Black Coalition for AIDS Prevention, that is Black Cap. and I'm the Mutual Aid Coordinator representing the African, Caribbean, Black communities. We'll be having a follow-up session next Wednesday, which is the first day of September 2021 at 6 p.m. Dr. Austin George will be discussing and answering your questions and concerns around COVID-19 hesitancy, back to school, and Delta variants. So I'll be dropping the registration link in the chat box. Please kindly click on it and register for the event. I will be looking forward to welcoming you all. Thank you.
Excellent. Thank you, Fumi. I want to invite Charlie next to speak to the upcoming event in York Southwest. Go ahead, Charlie.
Hi again, everyone. So my follow-up event is going to be around parents, caregivers, and back to school with COVID-19 protocol. We're having it on Friday, September 3rd at 7 p.m. We're going to be welcoming a couple of guests, a registered early childhood educator to speak on her situation with COVID-19 and back to school, and a teacher's assistant from the region of Peel will be joining us as well to speak on protocol that the different school boards will be doing for the back to school season. Just want to speak with parents and caregivers and have a chance to speak about what's stressing them out about going back to school for their children. And myself as a mother of 2 school-age children, it's very hard for us to think of what's going to happen since our kids were out of school so much last academic year, over 26 weeks. So I'm inviting you to join us on Friday, September 3rd at 7 p.m. And thank you very much again. Sorry, a train is passing by.
No worries. Thank you so much. I want to invite Karen to speak to the events in South and Central Etobicoke. Karen, do you want to quickly just talk about it?
Hi, thank you. So I'm Karen. I'm the mutual aid coordinator for South Etobicoke. We have a number of events that are being planned. I don't have any set date as yet, but you'll be hearing from me and from this community. So stay tuned and you'll be duly informed. Thank you.
Thank you so much, Karen. And I guess I'll go last. I'm hosting a vaccine support conversation that's focused on youth and the newcomer communities. Also the mutual aid organizers supporting the newcomer cluster, so newcomer communities. So please join me on September 7th at 6 o'clock, and I will be sharing the details with regards to that event with other events that will be circulated by email to the participants. And please, in the chat, include your email address or whatever contact information you're comfortable with, so we could follow up with you with regards to the upcoming events that are happening across the city, focused on African, Caribbean, and Black communities, youth and newcomer communities, but also focused on geographical locations such as South and Central Etobicoke, York Southwestern, Pelham Park, and Hyde Park communities. So I want to encourage you folks again to share your contacts. And I do see I see someone that's raised their question, so maybe we'll take that question first before moving on to the rest of the program. Lincoln, go ahead. Maybe Lincoln accidentally raised their hand. Lincoln?
No, sorry, that was an accident. I'm sorry.
No worries. I thought you had a question about our upcoming events, so I just wanted to make sure all the information was passed on.
Waleed.
Yep.
Waleed, I forgot the slide, but do you want to let people know about the next Dismantling White Supremacy event?
Yes. I was going to speak to that before we concluded. So one amazing event that we're putting together, and I just want to thank our panelists for helping us unpack a lot of myths that have been propagated against the vaccine, help us understand what's in the vaccine, help us understand the science behind the development of the vaccine, help us better appreciate the importance of having conversations with our neighbors regarding the vaccine. And what we want to also do is unpack the impact that we have had discussions about in our previous events, one being the dismantling white supremacy, specifically focused on medical racism. So we want to invite all of you folks to our dismantling white supremacy in healthcare event. It's going to be held on October 27th from 4 to 6 p.m. And we have some amazing panelists like Samia Abi, and also some great public healthcare experts such as Nahid Dosani. And so please sign up for this event. You will benefit from the experience of our medical professionals who've been advocating for systemic change to better support communities impacted by bias, such as medical racism. I think the last time we had this conversation, we had over 130 participants. So we want to do a better job promoting this amazing event in October, so we will have way more participants than our first event on white supremacy. I want to reiterate the comments on the chat, thanking our panelists again for an amazing job. Trevor, thank you, thank you, thank you. Dr. Candice Todd, thank you, thank you, thank you. Fernanda, thank you, thank you, thank you for sharing your knowledge, having this important conversation with us to make sure that we are informed, so we could build on the community knowledge regarding this novel virus that has continued to threaten the most vulnerable members of our community. So thank you once again. And I want to thank all our participants. We had over 40 participants in our conversation today. So I want to thank all of you for your insightful questions, for your support for this amazing mutual aid work in our communities. And I also want to thank our mutual aid coordinators who shared the details of upcoming events and for their important work in engaging community members in spaces to better understand the impact of this virus, this pandemic, and also the effectiveness of this vaccine. So please join us next week for the event-based conversation, the events that we have lined up, the various discussions we have lined up in September, leading to an amazing event that we'll have in October that's focused on how we can dismantle white supremacy in healthcare from a systemic level, because of all the various lived experiences we've heard from community members. I also want to encourage all of you to join the Neighborhood Pods TO project. Please contact us. We're on Facebook, where we have a page. We have a Twitter account, and our handle is pods_TO. We have an amazing IG account where you can help us get the word out, Neighborhood Pods TO, and we have a website that can also be a resource. We want your involvement and participation, even in the planning of future events. So please contact us if you want to get involved in planning future events. This work is fueled by love for our community. It's fueled by dedicated, healthcare professionals, community organizers, and community activists, and folks who deeply care about the community. So I want to thank you for your volunteers, and thank you for your work. Thank you for your support, and let's keep this conversation going next week with our first August 31st event, leading to October event focused on dismantling white supremacy in healthcare. Thank you once again.
Thank you for the amazing facilitation.
Thanks.
And
Thanks, everyone.
Thanks.
Much,
Thanks,
guys.
everyone.
Thank you.
everyone.
Bye, everyone.
And it's 8 o'clock. We finished right on time. So you folks can have dinner and spend time with your families and loved ones. And thank you for joining us tonight. This has renewed my respect and admirations for our healthcare professionals and advocates, especially our community advocates. We have a lot of work ahead of us, and I know we're going to do it together, and we're going to succeed. So thank you.
Sure.